Thank you so much for joining me today. I'm titling this, It Takes a Team to Heal a Chronic Pain Patient. What do I mean by that? Well, at A Healing Place The Estates, we believe in working with the whole person and the whole family system. And this takes a team approach. No one of us can do it by ourselves. So we have an integrated team of professionals who are trained and very educated in how to work with people with chronic pain with coexisting problems, including medication misuse, abuse, or addiction, and also the psychological problems that come along with a chronic pain condition, like depression, anxiety, trauma, or PTSD. There's a lot of moving pieces that need to be addressed from a whole person's perspective. We have a lot of what we call coaches and guides on the path here, using a multidisciplinary integrated approach. We have at our fingertips at least 25 different evidence-based integrated pain management modalities we use, in addition to the core clinical component, which is my addiction-free pain management system plus. And the plus is adding the integrated components to the core clinical addiction-free pain management process. So we want to help people in the biological area, but unfortunately most of the people we get, that's all they've been getting, sometimes for decades, is the biomedical approach. Pills, shots, procedures, surgeries, and never anything for depression, sleep, anxiety, trauma. And they just keep going and having their symptoms masked or band-aided. Unfortunately, a lot of this is done with opioids. And what's sad is there is no evidence whatsoever that supports using opioids for chronic pain. These medications were developed for acute pain conditions, some of them for very severe, like end-of-life pain, like cancer pain, chemotherapy pain. They weren't meant for everyday backaches, neck aches, and different things. Or when people go into the ER with an injury and go out with a 30 to 60 day supply of opioids. There's been a lot of hue and cry that needs to stop. But it's not about the meds, because some people need to be on appropriate recovery-friendly medication. So that's the biological area. In the psychological area, we want to work with how people think and do emotional regulation, how they can articulate what they're feeling in a healthy way. We also want to look at people's mistaken beliefs and skewed perceptions, which feed the psychological defense mechanism we call denial, or the inner saboteur. Some people call it the monkey mind. So we're looking at all that in the psychological area. Now, the social area is vitally important, because most of the people we've worked with have been in a really deep place that's dark. We call it the chronic pain trance, or the pit. One of our recent patients called it his isolation chamber or his cave. They have lost all contact with friends, family, and community. A lot of family members and friends have been burnt out, and they don't want to reach out to anybody for many reasons: shame, guilt, fear. And then the final domain is the spiritual, which we believe is the glue that holds it all together. And we're not talking religion here, we're talking spiritual. We want to see how in touch people are with their spiritual values, practices, and principles. And the treatment plan is designed to help them improve their levels of functioning in all four of those areas, including the spiritual. So it takes a team to heal a pain patient. And we have a great integrated team here at A Healing Place in Camarillo. To learn more about our team, go to the link under this video. You can also go to our contact page. And if you or someone you love is suffering with chronic pain, call our toll-free number, 844-388-4100. And if you hit extension 1, you'll go right to our admissions coordinator, Steve Serafino. He'd be glad to take your call. Or go to our contact page and send us an email. We'd love to hear from you and see how we can serve you. If we can't meet your needs, we will certainly help hook you up with somebody who can. And it's really crucial and important to believe that people can stop suffering with chronic pain. Pain's inevitable, suffering is optional, and I promise all my patients, if and only if you're willing to do the footwork, you never ever have to suffer with your pain again. And guess what? The patient is the captain of our treatment team here at A Healing Place. So we do individualized, concurrent, collaborative treatment planning with each and every one of our patients and develop a biopsychosocial spiritual treatment plan that's designed to improve their levels of functioning in all 4 of those areas. Thanks for joining me today, and onward and upward, and make sure to contact us at the links below this email.